Hey, have you ever been told good news? Your blood work looks normal, but you walk away thinking, if everything is normal, then why do I still feel exhausted? Why can't I lose weight? Why do I keep ending up back in the emergency room? Why do I feel like something just isn't right? As a registered nurse, I heard stories like this over and over again. Then, as I began coaching people through metabolic health, I noticed something. Many people weren't looking for another medication. They were looking for explanation. Today, we're talking about the one blood test that most people have never heard of, why it isn't routinely ordered, what it measures, and why understanding your blood work may help you ask better questions. Not because one test has all the answers, but because every test tells a part of the story. Stay tuned. If you're tired of sugar cravings, brain fog, fatigue, and all the conflicting health and diet advice, and you just want to know what's happening inside of your body, you're in the right place. I'm TaShawn Davis, holistic health coach, registered nurse, and metabolic health educator. I help you break sugar cravings through balanced blood sugar so you can take your health back naturally. So grab your favorite sugar-free drink, pop in those earbuds, and let's learn how to work with our body and not against it. Before you jump in, I wanted to remind us that this coming Wednesday and August 15th, we have our last two summer metabolic health tours. Both dates will feature Dr. Nelson Vasquez, helped over 200,000 patients with their metabolic health and reversing insulin resistance. Also, if you are wanting to sign up for our metabolic intensive, the last day to sign up will be August 15th. Head on over to healthbeyondweightloss.com and sign up for either one. I believe we will be streaming both episodes on Health Beyond Weight Loss, Metabolic Health, and Insulin Resistance on our Facebook page if you are unable to make it in person. So let's dive in. One of the things that stood out to me during my years as a home care nurse was how many patients seemed caught in a cycle. They would go hospital and home, hospital and home. Sometimes it was high blood pressure. Sometimes it was blood sugar swings, dizziness, weakness, and sometimes they just didn't feel well but couldn't put their finger on it. I review their discharge paperwork and I look at all their labs, and many times I'd hear the same thing. My doctor says everything looked okay. Years later, when I started coaching, I noticed similar patterns. People were frustrated because they didn't understand why they felt the way they did. That doesn't mean routine lab works were wrong. Routine lab work is valuable, but it reminded me every blood test answers a specific question, and no single test answers every question. That realization changed the way I looked at metabolic health. So, what is an A1C? Let's start with one of the most common tests, the A1C, especially if someone is looking to find out whether or not they have diabetes. If you didn't hear my last episode, you may want to go back because I pointed out something that is kind of profound that you want to hear. But most A1C measures blood sugar, is what most people think, but not exactly. It measures how much glucose has attached to the hemoglobin, the protein inside of your red blood cells that carries oxygen. Your red blood cells live for about 120 days. During that time, glucose naturally sticks to them. The more glucose circulating over time, the more become attached. That's why an A1C gives us an estimate of your average blood sugar over the past 2 to 3 months, with the most recent having a greater influence than the earlier weeks. That's pretty amazing when you think about it. One test can give us a window into months of your blood sugar patterns. What can affect an A1C? Now, here's something many people don't realize. The A1C isn't perfect. Certain conditions can make it read higher or lower than expected. Things like iron deficient anemia, blood loss. Some people kind of hack their A1Cs by getting their blood drawn before. But if you go back to the same pattern, your A1C is going to be over 3 months high again. But you can get a lower test for that one time. But the thing is to take care of yourself. A recent blood transfusion, kidney disease, pregnancy, some inherited hemoglobin conditions. That's why healthcare providers don't interpret an A1C in isolation. They should be considering the whole clinical picture. So, what about a fasting glucose? Imagine taking one photograph. That's your fasting glucose. It's a snapshot. It tells us what your blood sugar looked like at a point in a time after fasting. It's very useful, but it's just one picture. So, what is a fasting insulin? That's what we're here to talk about, right? Now, let's talk about it. It's a test that most people don't discuss fasting insulin. Notice the difference. Glucose is the fuel. Insulin is the hormone that helps regulate what happens to that fuel. Those aren't the same thing. Sometimes your body can produce more insulin to help keep blood sugar within the expected range. That means someone can have a fasting glucose and an A1C that doesn't raise concerns, while their body is working harder to maintain that balance. It's pushing out more insulin. So that's the reason why some clinicians use fasting insulin as another piece of the puzzle in evaluating the metabolic health. Many patients will say, my A1C and my blood sugar is normal. And I was thinking, how much insulin is it taking in your body to keep it normal? So, what is a normal result? This is where people often get confused. When you receive your labs, you usually see a reference range, right? A reference range helps laboratories compare your results with those from a reference population. It's an important tool for interpreting tests. But here's something important. A reference range isn't necessarily the same as an optimal target for every individual or every health goal. For example, some clinicians who focus on metabolic health or low carb nutrition may prefer to see fasting insulin even lower than the reference range. And others may use different targets depending on the patient's health history, symptoms, and overall clinical picture. That's one reason why you'll sometimes hear different opinions. They're often answering different questions. But why is a fasting insulin not routinely ordered? This is probably the question that you've been waiting for. Routine screening recommendations are developed using the best available evidence for broad populations. Fasting insulin has not been adapted as a standard screening test in many current clinical guidelines. Hopefully, with these changes, it will, though. But that doesn't mean it's not useful. It means healthcare providers use different tools depending on the clinical situation, the person's health history, symptoms, and what they're trying to evaluate. The important takeaway isn't that everyone needs the same test. It's that understanding what each test measures helps you have better conversations with your healthcare team. I would say if you are suffering with any signs of insulin resistance, holding on to fluid, skin tags, belly fat, high sugar, brain fog, tiredness, high blood pressure, you probably need to have a fasting insulin. So, no blood test should ever be interpreted by itself. Good healthcare looks at the whole person, your symptoms, your blood pressure, your waist circumference, your triglycerides, your LDL cholesterol, your medical history, your family history, your lifestyle. Blood work is just a tool, and it's not the entire story. So, if you've been told that all your labs are normal and you're frustrated because you still feel ill or you just know something isn't right, maybe it's time to ask your doctor to add a fasting insulin to your test. So, if today's episode has helped you understand your blood work in a new way, I think you'll love that Metabolic Intensive. It's a 6-week group coaching session that's going to dive into labs, it's going to dive into different fuels for your body, do some meal tours and swaps and encouragement, practical strategies that you can be empowered leaving discussing with your healthcare team. Learn more at healthbeyondweightloss.com. And always, please, guys, if you have been blessed by this, somebody else wants to know it. So leave a review. It helps more people see the episodes. Thank you for taking this time with me. My goal isn't to replace your healthcare team. It's to help you understand your body so that you can ask better questions, make those informed healthcare decisions, and become a partner in your health. Remember, you are needed in this hour. God bless you. Alrighty, my friend. If this episode has helped you understand your body a little bit better and helped you have the confidence to make better informed healthcare decisions, share it with someone you know who may be struggling with sugar cravings, brain fog, or fatigue, because they may not even realize that blood sugar could be the reason. And also leave a review because it really helps more people find this. Remember, the goal is to reverse 1 million type 2 diabetes in my lifetime. And as always, I want to remind you the harvest is plentiful, but the laborers are few. And some people are fighting every day just to have the health and energy to live their everyday life that they were called to live. So I am praying for your health. I am praying for your strength. And I'll see you in the next episode.